Hi, welcome to the Lisa Saunders Show. I'm Lisa Saunders, and I like to have a lot of injury prevention shows because as silly as it sounds, I am a freelance writer and I get a lot of injuries from just sitting there writing, neck, back, carpal tunnel. But I'm not the only one with problems, even though I have a sedentary job. Musicians have a lot of injuries, and maybe that makes more sense because they're lugging heavy equipment around, standing in front of an audience. But today we're going to do musician injuries, prevention and treatment. And I'm lucky enough to have Dr. Joanne Z. Moore, physical therapist of Shoreline Physical Therapy in East Lyme, Connecticut, here to tell us about musician injuries and what to do. And to make it fun, I invited Debra Lynn here, former singer for the Rolling Stone magazine band, lead singer for that band, magazine band, to come here. She's a songstress, writer, and she has a lot of original music that you agreed to play on my show today. Thank you.
Sure.
And she's willing to let you all stare at her posture to make sure if she's sitting correctly, and when she's playing the guitar, if, I don't know, shoulders, whatever it is that Joanne will say, whether she's doing it right or not, you're allowed to watch too and see what her injuries could be or how she could prevent them. And I do appreciate you bringing your original couple songs that I asked you to play. One in particular means a lot to me. You let me use it for a cause that I work on, trying to prevent the leading viral cause of birth defects, which is Cytomegalovirus. So you're letting us use a song, A Voice for Sam, that you're going to play now about a child who can't speak.
Right.
And my daughter couldn't speak because I caught that virus when I was pregnant. I didn't know that I shouldn't be kissing a toddler around the mouth or sharing food with them. So it's a very positive song, tender song that actually makes a lot of people cry when I give my presentations. So I do thank you for letting me use it. You have a lot of songs that you use for causes. Mothers Against Drunk Driving, Habitat for Humanity, but plus you also write some love songs, so you're going to share a love song that you wrote as well.
Yes.
So I thank you for that, Debra. So go ahead and start on A Voice for Sam.
Sam is my nephew, and this was written originally for autism, so I'm really happy that you're using it too.
Thank you.
How can I tell you that I want to go now when I cannot find the words? The other kids are playing all around me. I'm alone and something hurts. I'm a boy who's feeling scared of all the noises in my head. I can hear you, but I know you don't hear me. My mom is always so creative, finding new things we can try. Dad comes home each night with hope and fearful eyes he tries to hide. And my brother's on the run. I know it can't be too much fun. It's not easy living with a boy like me. There's a voice for Sam and all the others like him. We need to understand it's just who he is, and he needs us to find a way in. I know you're trying and I feel all the love, but I still need to ask for more. When you see me spinning and I'm jumping to a rhythm all my own, please be patient as you can and accept me as I am. I'm still changing, so don't give up on me. There's a voice for Sam and so many others like him. We've gotta do all that we can. He needs us to know, make sure that it shows we're there for him. The ways of those like Sam are full of mystery. Let's unlock the gates of silence, find a way way to set these children free. There's a voice for Sam, and too many more just like him. Try to understand, he needs us to know. Gotta find a way in. Be a voice for Sam and all the others like me. Be a voice for Sam, it's just who I am. Be a voice for Sam, keep looking to find a way in. Be a voice for Sam, don't give up on me. Be a voice for Sam. Thank you.
It's such a moving song.
Thank you.
Thank you. Well, Joanne, what do you say?
There's such a place for music in our lives, whether you're the musician or whether you're in the audience. So first of all, I just want to thank you for you sharing your gifts with all of us, because music can move us in ways that nothing else can, and it can express things that nothing else can. Mm-hmm. And so we really, as a society, we need the arts and we need the music. And so thank you for all the time that you've put into training for this, because you don't just sit down and do this.
That's true.
As a physical therapist, my job is to support you in doing that so that you can continue to play well into old age. My dad was 94 when he died playing his flute.
Oh, how nice.
He had been in the Coast Guard band for 20 years, so I have a very soft spot in my heart for musicians. So what would keep someone from being able to play from childhood well into old age? When I look at a musician, the first thing I look at is their posture. And you want your chair to fit you well. Mm. So if you're a small child sitting at a piano bench and your feet are swinging and your back is rounded, you're going to fatigue. And that child's going to say, I don't want to practice the piano, and not be astute enough to tell the parent why. So if you're the parent of a musician, try to look at the child. Are they comfortable with their chair, in their posture? Maybe they need a footstool to rest their feet on. Maybe they need a little back on the chair, like one of those stadium chairs. Look at them and make sure that they're fitting where they are.
Music teachers now, whether they're giving private lessons or in school, are starting to bring that awareness in?
They are very much into this because they're old enough to understand the ramifications of not doing it well. Right. So they do. The teachers do make a good effort, I think. Mm-hmm. Giving breaks during practice. There's no reason why a 30-minute practice has to go for 30 continuous minutes. Mm-hmm. You can do 3 10-minute practices and it'll be just fine.
Right. In fact, better probably.
I think so.
So how did she sit when she was doing? Do you approve of her posture?
Okay, I started at your head.
Okay.
And you were looking a little forward sometimes. Mm. So I want to check your eyesight. Are you seeing the music well, or do you need your glasses changed?
Well, that's a good point, because I know reading music brings a whole different level to it. Mm-hmm. I recently actually increased my prescription, so I think that should be okay. Mm-hmm. It just might be the habit sometimes of, if a room is not well lit, I might be straining a little bit. Mm-hmm.
A little light above the music sometimes, which you probably have at home.
I do. Oh yes, I'm
and
well equipped with lights.
A lot. Mm-hmm. Yeah. I noticed too that you brought your shoulders up quite a bit, and I don't know if the chair was too tall and the keyboard was too high, so that you had to do that, or maybe you were just putting body language into it and being expressive as a performer.
I don't know. I mean, it might be a little of both, and it'd be interesting to see the tape and watch the show myself to see, because I am thinking of many, many things, but one thing I'm not thinking about is how my body it's in the optimal position. Right. That's just not something that I have trained myself to think about, unfortunately.
Mm-hmm. Most pianists, if they have pain, is in their back. And that's from the posture. The thing is with musicians, my whole thing is musicians are athletes too. And musicians need to do preseason training. They need to do exercise of some sort to be strong enough so that they can do what they want to do. So the shoulder complex, the shoulder blade and up here, give us stability for our arms, and we do our fine skilled work with the hand and the fingers. But if the shoulders are weak, then we go into a rounded position and become susceptible to getting thoracic outlet syndrome or some other postural changes. Even the bones in the back in a growing child have the texture of modeling clay almost, a real hard modeling clay. And they should be nice square vertebrae in our back. But if you consistently have a rounded posture during childhood and youth, the bones will calcify and solidify in that direction. So then during adulthood, it's very hard to ever get that back. So our young people, we really want them upright.
Interesting.
Should we move to the guitar, or is there more you want to do? Are you ready for the guitar?
Let's
Yeah, I was just thinking, as she was, oh, sorry, I didn't mean to interrupt you. As she was saying that, I was thinking, wow, when I picked up the guitar, I was 10. And I'm sure I developed lots of habits because I always wondered why I can't move my neck as much as I'd like, and I can't do sit-ups without holding my neck, and I'll bet it's from sitting over the guitar for so many years.
Did you start with an adult-sized guitar?
Yes, it was what they gave us at the school at the time. In fact, I love to tell the story that when I started, we had the choice of the recorder or the guitar, and
Are you going to sit down and play first? Right?
oh yeah, that's great. That makes more sense. Okay, we're going to show the difference between playing as I'm sitting, and then about halfway through the song, we decided it would be best I'll stand up and show the difference because I have a strap all set. We can talk about the ergonomic strap that I found and what motivated me, and I'll do it about halfway through.
Now this is your love song, or you said, what was it about?
Well, it's really a song that I call it a love story, and it's about so that anyone can relate to it on a personal or a universal level. I think of it as a way to express that feeling of really wanting to convince someone of something, to change their mind. It's called a change of heart. So the strong desire and essence and longing to have someone have a change of heart, whether it's another nation or another person. Loved you as I've loved no other. You're the anchor for my dreams. I barely noticed as you slowly closed the door and slipped away from me. I long to stay beside you. Tell me, where else would I be? If I were to sing to you softly, a song of love that's pure right from the start, would those sounds be so sweet and clear for you to have a change of heart? You wear pride and power like a suit of honor. How I wish you'd take a look at all the ways that I have always been there, yet you close me like a book. Your answers come so quickly, they nearly take my breath away. If I were to sing to you softly, a song of love that's pure right from the start. Would those sounds be so sweet, so clear, for you to have a change of heart? Now I'll go into the bridge.
Okay.
Which is the, seems like a natural break. Tell me that you hear me, hear every word that I say. But really, how can you be listening while you're turning me away? I'll go on trying while the sun's still shining. I can't seem to let you go. With a glimmer of a chance you'll open, I'll hold on to that hope. No, I can help you to remember those days when all our time stood still. If I were to sing to you softly, a song of love that's pure right from the start, would those sounds be so sweet, so clear? Could my voice erase all your fears, for you to have a change of heart? Would you have a change of heart?
Wow.
Thank you.
What a heartfelt song.
Thank you.
Wow.
Thank you.
Well, please have a seat over here
I will.
so Joanne can tell you what she thinks.
Okay.
Well, thank you again. So, orthopedically,
Yes.
let's this time start at your feet.
Okay.
You wore some snazzy shoes
Hey.
with a little bit of a heel, which is fine. It's for performing, but you probably wouldn't want to practice in them.
Right.
Wear something more comfortable to stand in. But I did notice a big change in your voice volume when you went from sitting to standing. Clearly you had more access to air. You were able to breathe more deeply. I thought there was less of a forward head position when you stood. You brought your head back.
There is a comfort in performing and standing like that. I think it does expand the chest, and that's, yeah, and the price, of course, is the weight of the guitar on my shoulders.
Right. Tell me a little bit about the ergonomic strap that you have.
Well, I started thinking about ways to mitigate the pain that I was feeling after playing 2-3 songs. It was starting to really bother my neck and my shoulders, so I started watching videos of musicians that I grew up loving, Joni Mitchell, Joan Baez, and noticing that their straps were really thick, and I thought, well, that must help to distribute the weight.
Exactly.
And I really started going on an online campaign to see what was out there. And I went to lots of guitar stores, and there really is not a great resource that is easy to access. So I did my own research and then found a company that makes this ergonomic strap, and it helps. But I would like to, I mean, one of those things I'd like to get to
You'll
is
have to
maybe get
invent
the help.
something.
That's really something. I think that's a great idea, actually, because it's really in demand.
Exactly.
Because, I don't want to ever stop playing guitar. I love it.
I think this generation just doesn't want to get old. People used to just retire, and we're not willing to do that.
Yeah, well, that's true.
But the other place where I saw you at risk is with your left wrist, because you're in a lot of flexion here, and This is the carpal tunnel in here, and if you compress the nerve in here quite a bit, you can get numbness and tingling in your hand.
Yep. Which I'm feeling right now.
Okay. Carpal tunnel syndrome is just pressure on the nerve right here. And so we put you into a little splint that rests you in this position during the night. Some are over the counter and some you can get. My colleague, Catherine Leindecker, is an occupational therapist and she's a certified hand therapist.
Oh, really?
And she builds custom splints to suit you really well.
And is that, so the carpal tunnel is really a function of the pain that tends to radiate from this joint here?
It's not in a joint. It's a little spot between a couple of bones, and then there's a ligament crossing over the top, and the nerve is running under that ligament. So if the muscles hypertrophy, or if there's any fluid retention, or even prolonged compression, you can irritate that nerve. And if you wear the splint and rest it, or put ice on it after you perform, then you can reverse it very often.
Oh, really?
There are times when an orthopedist or a hand surgeon will inject it with a steroid, or even do a little surgery and release the ligament so that the pressure's off of it.
That's the worst case scenario.
That is.
I actually did see a hand specialist once, and I just was too frightened at the time.
Well,
But,
if you can treat it conservatively, try that.
Right.
A neurologist would do a nerve conduction velocity test. A nerve should conduct impulses from point A to point B at a certain velocity. And so if the nerve is being pinched, that conduction is going to slow down, which is going to impair your alacrity on the strings. And so you don't want to keep that. And then there will come a point where it gets so slow that it's irreversible damage. So you want to try to fix it conservatively if you can, but intervene surgically before it is damaged permanently.
Yeah, that's a tough call.
Well, you use the nerve conduction velocity test to make the call.
I'm sorry, when you wear the splint, is the suggestion to wear it as much as possible at rest?
At night.
Oh, only
typically.
at night? Oh, okay. Oh, that's not bad. So you can sleep, I guess, learn to sleep with
Right.
it.
Yes, absolutely, absolutely. We slept with curlers in our hair. We can sleep with this.
And it plugged in, too.
Right. Yes. And the thumb tends to get osteoarthritis in it, in here. And then we would use something, I don't know if that would fit you. This is for the right.
That looks like the one that I want.
Something you've had.
That's the other hand, yeah.
Okay. That's a custom-made one, so it may not fit you, but you can get over-the-counter ones.
Well, that's not bad.
Okay, right. And you can see how that would help.
So it's actually the idea of keeping this finger away
And resting.
from that one. Okay.
It's resting.
When would you wear that?
You could wear that all the time. But you don't have to. It depends on how much pain you
I
have.
don't
And
have to wear any bracelets anymore.
that's right. There are silver splints that really look like jewelry. They're quite nice.
I'm sure it's evolving, I'm sure. Yeah, this is almost the right size. It's a little tight.
It's sorry about that.
No, it's okay.
This is what we use for tennis elbow. Tennis elbow is also lateral epicondylitis, and it is a tendinitis of this muscle right here, the extensor carpi radialis brevis. And if you have that, it hurts to extend your wrist and hold it in this manner. So push against my fingers. People who have that will have pain when you resist this. So the treatment for that is wearing
Things seem to have that one, so.
this Aircast splint. And I'm not advertising for Aircast, but there, and I don't make a profit on this.
And just so you know, we have 5 minutes, so left.
Okay.
So think about what you want to talk about.
Okay. Did you want to,
No, I'm not going to.
you're not going to work on the table this time?
I'll tell you what. The main thing for musicians is pre-season training. You need to be so in shape. Musicians don't think of themselves as athletes.
It makes sense, really, to shift the whole consciousness about it, at least for the younger generation, so they can start appreciating it.
Right, and where we see the most injuries come in is in, say, a college student who doesn't play all summer and then has to go back to the Hart School of Music or Berkeley. and they'll start practicing 8-10 hours a day for those 2 weeks before they go back, and that's when they develop tendinitis and other problems. So you don't want to go from nothing to practicing 8-10 hours a day.
Well, what about if you say it's a seasonal thing, but someone like me, I'm playing all the time, so it's really about making it part of your routine.
Right.
Yeah, I mean, the same way I would maybe do some yoga stretches, add
Absolutely.
some appropriate.
Absolutely. And my information has been up on the screen. You can contact me at Shoreline Physical Therapy in East Lyme. I would be happy to send any musician a set of exercises to do.
Oh, thank you.
And I think you have a CD as well that's available, right?
I do. I have 3 CDs, and you could access the information on my website, which is going to be on the screen, debrasong.com. And that's a great idea. We could actually link so that people that were musicians that I know, I'd like to tell them more about this, because I would love to spread the word and help more people prevent pain. That would be great.
Yeah.
I think because you didn't have a chance to do the exercises on her, can you two come back and we do a second show?
Sure,
I'd love to.
Because so there's actual stretching you could show on her. I think we should do that.
Let's do it.
Well, thank you.
You're welcome, because I feel like this is a big topic.
It is. We've just scratched the surface, I think.
Okay, that's great. So you said you would send anybody exercises, and people, again, your website is, and they can, like, I visited you for my foot problems, and so I love visiting you there. So where can they find out about you?
Shoreline-pt@.com.
And I've had I've had some of your interns on doing what? You did the gardening, right?
Gardening and snow shoveling.
Snow shoveling, right. So you both have a lot to share, and you've been on my show before.
Yes.
So I do appreciate you being the guinea pig and letting the whole world look at your look at your back.
I'm an open book, what can I say?
So they can judge you. Now we have 2 minutes left. So what do you wish, is there anything else you wish people knew for either of you?
Well, I have this idea of, I have a blog. I think I'd like to talk more about this and start writing more about it, because I've always been interested in health issues, and to tie that in with music makes so much sense, and I wouldn't have thought of it if Lisa hadn't brought us together like this.
It does. And I think the other point that I didn't get a chance to make is to relax and enjoy the music.
Yes, yes.
Because tension makes us do everything with more power than is needed. But if we're relaxed and happy, we use the appropriate amount of force, and we tend to have less injuries.
It's a good reminder.
Wow, thank you so much, both of you, coming on. And I got to relax because you played, you talked. So this was a lot of fun for me. And I can't wait for you to come back, because I'd really like to see these exercises. Because who knows, maybe I'll take up the recorder or something. Isn't that I think Maria von Trapp, when I wrote for you, my Widowers of History column, I did Maria. Well, I just mentioned her as a widow after Georg, and she thought anybody could pick up a recorder. So maybe I will have that and get some injuries so that you can help me with.
Thank you so much for having us.
Thank you, Debra.
Thanks, Lisa.
All right, thank you so much for joining us on the Lisa Saunders Show, and I will see you next week. Goodbye.